Welcome to EAU podcast series Exploring Urology, a roadmap for medical students. In this first episode, Introduction to Urology, we are joined by Professor Henk Van der Poel and Dr. Alexander Eng. They will explore what makes urology such a unique and rewarding specialty. Whether you're considering urology as a career or are simply curious about what it entails, join us as we uncover why urology is an essential part of modern healthcare and an exciting career path.
Welcome, everybody. My name is Henk Van der Poel. I'm a professor in urology in Amsterdam, the Netherlands, in the Cancer Institute. I was trained over 25 years ago by Frans de Bruyne in Nijmegen, and I'm happily performing urology for 25 years. And I'm glad that the EAU allows me to explain a little bit what urology actually is. So me and Dr. Alexander Eng will present to you some interesting data on urology. What is urology? Where do we think we're going? Why would you be interested in urology? Alex, maybe you introduce yourself first.
Yeah, thank you, Henk. So I'm Dr. Alexander Eng. I'm a PhD student at University College London with a subspecialty interest in prostate cancer.
Thank you, Alex. And you have many more hobbies within urology, among which is the making of podcasts for newly future urologists and medical students. So I think it's interesting to have a little bit of a view on what's urology doing and where does it come from. And actually, the first urologist was in Paris, Félix Guyon. That's generally known. He was starting urology in 1890, which is over 100 years ago, 130 years ago, by removing a bladder. And that's basically where the profession started. Alex, I think you know that urology came from surgery. What do you think makes it stand out from general surgery?
Yeah, so great question, Henk. I think urology is a very distinct and one could say a very subspecialist field compared to general surgery. We know that urology encompasses various parts of the lower part of the body. So we know primarily it covers the kidneys, the bladder, the prostate. But more to that, it also covers other areas, including incontinence, impotence, infertility, cancer, and also reconstruction of the genitourinary tract. So as you can see, it's really a diverse specialty that primarily covers the abdomen and pelvic regions as well.
Exactly, Alex. And what drew me towards urology was the fact that it has so many things in it that you can explore medicine in its full potential. I'm basically a professor now in image-guided surgery, for example, which is a very specialized field of urology. But urology is much more than that. And I think it's important that medical students need to learn what the field of urology has been coming from, what it's doing at the moment, and where we think we are going to in the future. And this is where this series on urology for medical students will be targeting. So for today, I think, Alex, we need to focus a little bit more into detail on what you think will make a good urologist. Who is most likely to perform well becoming a urologist?
Yeah, that's another great question. I think someone who'd make a great urologist is someone who's obviously surgically inclined, possesses the technical skills, the know-how, and the knowledge, but is also someone who is interested in surgical innovation, technological advancements, and research. And as you've mentioned, urology is a rapidly advancing field. We know it's probably the leading surgical field in robotic innovation, robotic surgery. But as you mentioned, image-guided surgery, image reconstruction, improving the diagnosis of urological cancers with imaging, it's really at the forefront. And someone who possesses the desire, knowledge, and drive to improve the field would probably be an ideal candidate. And what do you think, Henk?
Yeah, I think great points, Alex, great points you're mentioning. And it's always a little bit confusing for somebody who's starting in the field of urology or considering urology. What actually are my traits? What do I need to take to the field in order to be successful? And I think this is the challenge in urology in general. But it also makes the beauty of urology because it allows everybody with any talents to be very active in the field. You can do either go into surgery, which is the basic of a profession. To be honest, Alex, I don't want to disappoint younger urologists, but surgery will be less and less for the future. I mean, urologists will be involved in diagnostics and selecting patients. Counseling patients will be crucial. but also technological developments often started in the field of urology. For one example, I think laparoscopy, looking into the abdomen and doing minimal invasive surgery, was always taken up very quickly in the urological field if you compare it, for example, to surgical fields. So urologists are more, in my view, also the innovators in medicine. And I bet you working in prostate cancer, you can have some examples to highlight there, Alex, as well.
So urology is definitely one of the innovators in surgery, but also I would say the trendsetters too. We know that urology was one of the earliest specialties and probably the largest specialty that uses robotic surgery. Within urology, we can use robots for kidney cancers, kidney tumors, bladder cancer, and even prostate cancer. Even within prostate cancer, we have single console robotic surgeons. We have transatlantic operations being performed recently, demonstrated each year at EROS. And we also have the latest advancements with single port robotics being explored to reduce patients' morbidity and improve return to normal life functioning afterwards as well. And even within that, we have 3D reconstruction, augmented reality being used within robotic surgery and robotic planning as well. So I think it's definitely a very innovative field.
I fully agree, Alex. I think these are very interesting, valid points. And it also allows somebody who's choosing urology as for his professional career to differentiate on the fly. What I mean by that is when you start training in urology as a resident, you probably don't know whether you're either going to be a surgical urologist or a more medical oncology oriented urologist. But these are the options you have. And I think in the field of urology, patients often are seen by the urologist initially. And the urologist is leading the multidisciplinary team discussions. They're introducing patients and they're collaboratively with other professions treating these patients. And that is what, in my view, is making urologists a very attractive profession, since you need to know a little bit of most of the professions that are surrounding you, like the radiologist, the medical oncologist, gynecologist in some cases. And that's opening up a wide area and a wide field of diseases where you can further specialize and become an international expert if you want to, or become a more practical urologist doing daily urology in a more general practice. I think those options are very important reasons for me to promote urology among young medical scientists and young medical professionals, because there are so many options to evolve.
Completely agree with you there, Henk. Urology is one of those specialties where you can choose to be a general urologist and see day-to-day patients in the hospital, but also, as you've mentioned, to subspecialize within very specific areas of urology and to be part of the multidisciplinary team. And as you've mentioned, we work very closely with lots of people, including medical oncologists, nuclear medicine physicians, our pathologists, and even radiologists. And there is all sorts to do from the diagnostic screening stage to the treatment and to active surveillance and so on. So it's a very varied and very wide specialty to look into.
Exactly, Alex. I think it's often underestimated the urological need patients have in nowadays societies. It's like 4 of the top 10 cancers that are now leading the cancer charts are being treated by urologists. I think it's important to remember that, but it's going all ways. We have fertility treatment for male infertility. We have pediatric urology dealing with many pediatric urological diseases that are not being treated by either surgery or medical oncology. So I think there is a wide variety of options that it's really worth taking a look into what a urologist is actually doing. And this is even more important considering the fact that I don't know for your country, the UK, Alex, but in the Netherlands, I think a medical student during his 5 or 6 years of training basically got like 3 weeks of urology training specifically. That is insufficient to have a good view on what a urologist is actually doing. So what I can recommend to young medical students considering a career in urology is go and do some science, go and visit urological clinics and get acquainted with the actual practical training that urologists do get and the expertise they do develop, because that's, again, lacking in most countries in Europe.
That's a very important point you've made, Henk. And one thing you've touched upon is the exposure to urology during medical school. We know that recent work has been performed at the EAU by Juan Gomez in the European area and also in the UK from Burst Urology, the LEARN study. And essentially, they've both identified that exposure to urology in medical schools is somewhat lacking and perhaps not long enough. And specifically within the United Kingdom, the LEARN study found that 1 in 5 newly qualified doctors did not have a clinical attachment in urology. And we also know that urology is a very prominent specialty internationally. I can just give some quick statistics from the UK. We know that about 10% of all surgical consultants in England are urologists, and 1 in 5 acute surgical referrals will be urological in nature. 1 in 5 NHS hospital inpatients will have a urinary catheter during their admission. And also, 1 in 5 newly qualified doctors in the UK will have a urology rotation during their first 2 years. So, as we can see, urology is a very, very prominent specialty, even for the doctor who doesn't become a urologist. And managing patients with catheters, urinary retention is an all too common procedure that not everyone we've identified has exposure to or the knowledge to manage this. And I think this is really important to stress and something we need to encourage our medical schools and students to become more interested in as well.
Yeah, I fully agree, Alex. I think it's not only the urologist who is seeing urological diseases, but also the profession surrounding us. And often these diseases they're facing are quite delicate, like erectile dysfunction, sexual problems correlated to urological diseases. And this allows the urologist really to add to all the medical care that is being given outside the urological field in order to, for example, improve functional outcome after small pelvic surgery, etc. So I think urologists have a wide spectrum of not only diseases to be treated, but also treatment options that they have. You mentioned surgery, you mentioned medical oncology, you mentioned even physical therapy for some small pelvic problems with, for example, urinary incontinence. And for that, I think it's often, even for me, difficult to choose where to go, what to be using in your daily practice. And then again, one of the issues that is going to change our field tremendously, Alex, and that is for the future. I think immunotherapy, like it did in lung and melanoma treatment, will change bladder cancer. It did change renal cancer treatment already, and it will probably also change prostate cancer treatment. So in the future, a urologist will be a medical oncologist to some extent, giving perioperative treatments, systemic treatment to patients that they do surgery on. So for that, I think the knowledge of urologists has to increase. I think, and I'm curious for your view on that. Don't you think urology is such a broad profession that even urology will split up again and become sub-professional, super specialist? That's what we see generally going on in larger hospitals already. What's your view as a young urologist on that phenomenon?
Yeah, so as we know, urology is becoming an increasingly subspecialist field. So even when you enter urology training, you can pursue one of a number of avenues, be it academic urology, endourology, uro-oncology, and even within uro-oncology, you can subspecialize within any of the number of cancers. So if we take prostate cancer as an example, we know that this subspecializes even further. You have prostate cancer screening, prostate cancer diagnosis, prostate cancer treatment divides into surgery, focal therapy. You have active surveillance, watchful waiting. There's such a broad range of areas that even these specific subspecialty fields in prostate cancer, you have individuals who specialize in them. So I agree to some extent. We may see further subspecialism in the future. And these may require further training, fellowships to become the experts in these areas. But I agree, it's becoming an increasingly subspecialist field.
And that's crucial. And this sounds all very theoretical. Maybe you and I, we just run through a typical week of being a urologist, Alex. That may give the better picture as well. So for this week, I will be on Monday having some meetings, doing some science, preparing my outpatients. For Tuesday, tomorrow, I will be doing outpatients on a variety of clinics in a multidisciplinary team treatment. On Wednesday, I will have a full day of surgery, doing prostatectomies. On Thursday, I will have a full day of surgery doing prostatectomies. And on Friday, I will have a full day of surgery for doing a cystectomy. And most surgical procedures we do now robotically. So you can see it's a great mix of doing outpatients, doing a lot of active treatment. Can you summarize a little bit the week you're facing, Alex?
Yeah, of course. So at the moment, not doing too much clinical as I'm a PhD student, but just before starting my PhD, the average week in a tertiary referral centre in the UK would involve you'd have your daily ward rounds of patients admitted overnight and our inpatient list. You would have to go see patients in A&E presenting with acute presentations such as stones, suspected torsion, urinary retention, hematuria. And after that, you would have clinics to attend to. So you have inpatient flexible cystoscopy lists, you have theatre to attend to. So removing stents, inserting stents, removing stones, putting in suprapubic catheters. In addition to that, you also have multidisciplinary team meetings. So we have patients to discuss for stone management, complex stone management, and even cancer cases as well. So as more junior trainee, there's all sorts of things we do in a day-to-day part of being a urology trainee. And definitely as you become more senior, your roles definitely increase, become more subspecialist. And as you've mentioned, you have a lot more meetings and plannings in place as well.
I think it's a nice description of the week. There might be one thing we sometimes forget in urology, which is emergency urology. Me, myself, I'm working in a medical institute where emergency oncology does really not exist, but a general urologist is often seeing many patients that need acute care. Since you're more close to that part of urology, can you say a little bit what's keeping you up at night? What phone calls, what emergency do you have in urology?
Yeah, so overnight we can receive phone calls from a number of places. So from inpatients on the wards, but also from A&E with patients who've just arrived in hospital. Some of the things that keep us up at night will be patients in acute urinary retention. Very often they're post-operation. Patients got suprapubic pain. They've not passed urine for about 8 to 10 hours. Bladder scan shows over a litre of urine in their bladder, and no one's able to catheterize them. So you will very often get the call, difficult catheter, can you come and manage the patient? And as a urologist, it's a very, very rewarding opportunity to be able to quickly assess the patient, put in a catheter, drain the bladder, and immediately you see relief on the patient's face. So that's a very common thing we get called about. Other things we get called about and possibly quite worried about would be patients with possible acute testicular torsion. Young male presenting with testicular pain for a number of hours. We know that there's a 6-hour window to get them to theatre if required. We need to rapidly see them and assess the situation, but also patients presenting with frank hematuria, be it if it's for a known malignancy or an unknown cause. These patients can keep us up for quite a number of hours overnight as well. And we know that the management of hematuria is not always standardized internationally, and a lot of work is being done into this at the moment to see what best practice should be.
Excellent, Alex. Yeah, it's like you say, it's sometimes keeping us up at night. And what's interesting as well is traumatology. We are involved in pelvic fractures often when the urethra is damaged, and you have to take action quickly in most cases in order to prevent further damage. And I think that's why urology can be a very rewarding profession where you can not only diagnose the problem the patient has, but also help them very efficiently and effectively. And many of the things we do as urologists, like cystoscopies and you already mentioned laparoscopy, are purely done by urologists. And that gives you, as a urologist, a very special position within the hospital. And I think we can conclude there, Alex, and you mentioned that before, that many professions, they are just needing urologists in order to solve so many important issues for patients. And I'm happy to be a urologist, and I'm sure that many of you listening to this podcast will also be if they take a very good look at the profession.
Definitely, yeah. So, Henk, in your country and perhaps in Europe, what are the steps after medical school for a newly qualified doctor to become a urologist?
If you want to be a urologist, you need 5 years of training. And that 5 years comprises of 1.5 year of surgical training. So you'll be part of a surgical team on a surgical department, learning surgical treatments, in particular bowel treatment or abdominal issues, abdominal surgery. You will get a lot of experience in the surgery, being trained on a surgical department. And after that, you go into a more specific urological department where urological diseases are treated. Among urologists, you'll be trained for more specific and general urology. Many of these trainings, they comprise a small part of pediatric urology, a little bit of oncology, a little bit of female urology. All different aspects of urology will be dealt there. And in the last 1 or 1.5 year, you'll be trained in a specific field of urology. Like we said, urology will differentiate into more subspecialties, and you can either choose for oncology or functional urology, or even pediatric urology being a specific fellowship training.
Yeah, that's a very thorough overview of the training pathway in Netherlands and perhaps Europe as well. In the UK, it's slightly longer, the training pathway. So medical school is typically 5 to 6 years. After that, newly qualified doctors go through what's called a foundation program for 1 to 2 years, where you have general rotations over those 2 years. And after that, you enter core surgical training for 2 years. And as you've mentioned, you have experience in general surgery, perhaps in urology as well, just to build the general surgical skills. And then after that, you apply for specialty training. And that's when you would select to go into urology training. And typically that's for a further 6 years before you qualify as a potential consultant in urology. So in the UK, the training pathway is a bit longer. It's about 10 years in total after you graduate from medical school, but very similar training pathway otherwise. Learn general surgery, general urology, and then you subspecialize as well.
Clear, Alex. I think that's a nice summary of the first 10 years of your career as a urologist. And after that, it's not finished. I think urology is one of the strongest united professions, especially in Europe, where they have the European Association of Urology joining about 12,000 urologists meeting annually, having a lot of activities, getting further training, allowing you to publish, having their guidelines very nicely available online. If you think about urology, try to visit the website of the EAU. I can really recommend that, www.euroweb.org, and you can find lots of information and lots of very interesting courses already in order to see whether urology is something for you.
Henk, so I think we've given a brief overview and introduction to urology this episode. What is one piece of advice you would have to medical students considering or planning to pursue a career in urology?
Yeah, it's an important question, Alex, because when you start on the journey in urology, it's important that you know where you're going. As I explained, you can go either surgical or diagnostic or more into the field of medical oncology, etc. So if you have the idea that you want to become a more surgical oriented urologist, make sure that you get your training in surgical dexterity very early. Test yourself and see whether you like it. See whether you have the stamina to be in the operating room for longer periods of time, and you have the dexterity and the qualities to be there. I think that is important to realize that, and that is where sometimes urology training may lag a little bit behind. So urology is a profession for both diagnostics, non-invasive, non-surgical treatment, as well as larger surgical operations that you can do as a urologist. But early in your career, I think it's interesting and it's good for you to realize which of the ways you want to practice urology later on.
Completely agree with you there, Henk. It's definitely important for students and newly qualified doctors to try and get the exposure and experience in urology so you understand what the specialty involves in day-to-day practice, but also the opportunities for you to further subspecialize is something that's really important to get an early understanding of and to gauge your interest as well. So with that, we would like to draw to an end episode 1 on the Introduction to Urology as part of the new series, Exploring Urology, a Roadmap for Medical Students. We would like to say thank you in particular to the EAU and the ESU for this opportunity.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.